Expanded health care for veterans thanks to a new law called the PACT Act. The legislation applies to veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post-9/11 eras.
The medical director of the Dublin VA says it will help more than 3 million people across the country. Remy Cohen visited the Carl Vinson VA to learn about the difference it could make.
Gregory Swartz served in the Gulf War. He says this PACT Act helps put a name to a condition.
It's given us closure. I get a cough every year that lasts for about three months, and it's an unexplained cough.
Swartz says he's one of the 200,000 that are suffering from Gulf War syndrome, a cluster of medically unexplained symptoms. That's about a third of the force who went over to Desert Storm.
There was so much dust. We had to do burn pits all the time, daily. And then as we got closer to Kuwait, the smoke from the oil fields that they were burning, it was like a day like this right here. It'd be pitch black.
The PACT Act stands for the promise to address comprehensive toxics. There's more than 20 new presumptive conditions for burn pits and other toxic exposures, like Agent Orange and radiation.
Illnesses that were potentially unexplained or things that have developed over time and have had an inability to really prove that it was a result of their military service.
Manuel Davila is the executive medical director of the Carl Vinson Medical Center. He says the act requires the VA to provide a toxic exposure screening to every veteran enrolled in VA health care.
I hope that those veterans that are not getting care come in here and start getting their care, get it looked at, put a name to it, start getting your benefits.
Davila says out of the 49 counties they serve, 170,000 veterans don't receive VA benefits. He hopes to see that change. In Dublin, Remy Cohen, 13 WMAZ News.
And those services will start October 1st in Dublin for those veterans enrolled in VA healthcare.